what is a mommy makeover? Well, what does that mean? Does it mean only moms can have mommy makeovers? Hi, I am Dr. Judith Gurley, a board-certified plastic surgeon in St. Louis, Missouri. What a mommy makeover basically means is we're operating on more than one body part, typically the breast and the belly, kind of as a combo operation. That takes a little of the confusion out of what is a mommy makeover. Some examples of a mommy makeover would be a breast lift or a breast reduction or a breast implant remove and replace or augmentation, together with a body operation like a tummy tuck or a mini tummy tuck or liposuction or a combination of those things. We really also focus on the lower abdomen or the mons area, the fupa. Sometimes we can focus on the arms or the thighs together with breast. And often mommy makeover can even include some facial things, a little bit of liposuction under the chin or an eyelid lift or things like that. So a mommy makeover to me is just helping a woman get back to the body and the look that she once had. Because typically mommy makeover is going to include the breast and the tummy, I'd like to focus on that today, because patients say to me all the time they would have done a mommy makeover earlier had they known the recovery was so easy. Let's focus on recovery, and we're going to break it down into garments, restrictions, and scar treatment. Focusing on garments after a mommy makeover is very important. So when you wake up from surgery, you're going to have some comfortable, compressive garments on. And I want to emphasize the word comfortable. So garments for the upper body or the breast area look something like this. There's a zipper, there's Velcro on the shoulders. This is something very easy for the surgeon to put on you when you're asleep and you wake up with this on. And for the body, we have sort of a girdle that has a zipper all the way down. And that allows you to easily put it on yourself. It allows us to put it on during surgery, and it just makes things that you would do during the day very easy. And then as time goes on, we transition patients into what we call transition garments, or a step 2 garment, which would be a little bit less compressive, a little bit easier to wear under clothing so it doesn't show. This is a little bit more low cut, but this is sturdy enough to either hold a breast augmentation or a breast reduction or a breast lift, and even help with liposuction that we might do around the breast or the arms with a mommy makeover. And then for the lower body, we transition into a more user-friendly, compressive undergarment that can transition you from that heavy surgical girdle to just wearing regular panties. These are compressive, but again, I want to emphasize comfortable garments, very, very important after surgery. It also helps make patients more compliant when they're comfortable and they're easy to hide. And then over time, we transition our patients into beautiful, just normal undergarments, and we help with them. We help them understand their new size and what is going to be user-friendly for whatever surgery they had, whether it's breast augmentation, a lift, a reduction. And then I also want to emphasize with the lower body that this will help with liposuction as well as a mini tummy tuck or a full tummy. So recovery after a mommy makeover, worst case scenario, is 6 weeks. When patients tell me that they realize that within 6 weeks they can do whatever they want, they always say they would have done this earlier. So I want to go through the timeline of recovery after a mommy makeover. Again, worst case scenario is 6 weeks when I'm doing breast surgery together with a full tummy tuck and muscle repair. So if we do a lesser of an operation, like a mini tummy tuck or just liposuction, the recovery is not that long. Within a week or 2 of surgery, patients are allowed to lift anything that's 3 to 5 pounds, no problem at all. We do want to limit 10 pounds on up for a couple weeks. And then a couple weeks after that, 15, 20, 25 pounds, so that by 6 weeks there are no restrictions in heavy lifting. Also, in terms of moving, I want patients to gain full range of motion, moving arms, bending, twisting, getting their full body movements back before they start lifting weights and things like that. So start off with walking, stretching, and then over time getting more active, walking faster, maybe a light jog, so that by 6 weeks there are absolutely no restrictions. We don't have you do nothing and then 6 weeks do whatever you want. We have you gradually start doing more every couple weeks so that by 6 weeks you are back to normal. And so during the warmer months, patients want to know when they can get in a bathing suit, when they can swim, and things like that. So we actually have some undergarments for bathing suits, which can really help, especially with the breast surgery that I do. But really, if patients are getting into chlorinated water or even an ocean, I usually will allow that to happen within 2 weeks of surgery, depending on their healing. And again, by 6 weeks, no restrictions at all. The last body of water I want a patient to get into is something like a lake, where the bacteria level is a little bit higher than a pool or an ocean. Patients always want to know, how can they get the best scar? So we do have a scar post-procedure protocol that we like to follow and make some very specific recommendations. But it starts with surgery. It starts with the type of sutures that I use, not pulling tissues too tight, and wearing supportive garments. The other piece to good scar formation is going to be a new product that's been on the market now for a little while called silk tape. This is a breathable, non-adhesive type of tape that allows the body to heal but still breathe and not be subject to a lot of the sensitivities that patients are sensitive to. This scar tape or silk tape is really user-friendly for breast surgery, tummy surgery, and I have just loved it. We let this stay on for up to 3 to 4 weeks, depending on how the patient is doing. So it all starts with surgery and what we do in the operating room. As time goes on, patients get a little bit dry under some of the garments that I showed you earlier, and they don't breathe as well as this beautiful tape. So patients need to exfoliate. And the best way I have found to have patients exfoliate is with this wonderful Beyond Body Triple Action Renewal Serum. It does have exfoliating features to it while also moisturizing. So as patients might get a little bit dry and flaky under the garment, we have them start using this just once a week. It's all the exfoliation they need, and they can do this after surgery for as long as they want, or even if you haven't had surgery, it is a wonderful body exfoliator. And then as time goes on, once the silk tape is removed, we're now maybe 4 weeks out from surgery or so, and I have looked at every single piece of an incision, and I have deemed it safe to start using a scar cream. We do recommend our scar cream, which is very user-friendly. It's anti-inflammatory, it helps calm down the scar, get the red out, and help it flatten and heal more quickly and beautifully. So this is a safe scar cream to use on mature scars once the surgeon has deemed your scars mature enough to start using scar cream. I think one of the best places to start if you're considering a mommy makeover will be to find a board-certified plastic surgeon, first and foremost, and second, go to their gallery. Please visit my gallery, my Mommy Makeover gallery. You will see all types of patients who have had breast augmentation, breast lifts, correction of breast asymmetry, or tubular breast, or breast reductions, or remove and replace implants, together with body procedures, whether they be a contouring liposuction, together with a mini tummy tuck or a full tummy tuck, muscle repair, monsplasty, labial surgery, maybe brachioplasty, submental liposuction, blepharoplasty. These are things that all go together, and you need to see the surgeon's work to know if their idea of beauty matches your idea of beauty. We talked about Mommy Makeover and really focused on recovery. But if you have any questions about the consultation process, or if you're a good candidate, please call our office with any questions that you have, or if you want to schedule a consultation.